I was at boarding school in Tengku College, and I was one of the students who did quite well, and there was a program that chose students even before the SPM results, so on forecasted results, to go to Australia for our sixth form. At the time, you know, you're 17, you're barely 17, you kind of like, okay lah. I went there really not knowing that was what I wanted to do, because I don't come from a family of doctors at all. Then in Australia, I did okay in my high school certificate and got a place at Monash to do medicine. Once you graduate, then you do your internship. In Australia, you almost have to decide to then be channeled into which specialty training. So it was between cardiology and infectious disease. The more I got into cardiology, the more I realized it's a mono system problem. You're just looking after the heart, you know. Whereas infectious disease, you're looking after the whole person. So again, I was still a medical student when HIV/AIDS was described. I still remember I was in my fourth year when, you know, the whole phenomena was described. And then, you know, it became more and more interesting. And then as part of the training, I was at a specialist infectious disease hospital called Fairfield Infectious Disease Hospital. The atmosphere was so nurturing and conducive. It was that sense of teamwork, collegiality between consultants and trainees was just fantastic. I had some of the most amazing patients. I used to teach as well at Fairfield. We would get students from both Monash and Melbourne Uni, and you know, and you take them to see these patients, and you know, they taught us a lot. Imagine facing death, facing rejection, facing stigma, the strength that they brought with them, you know, the resilience. So all those things, you know, really taught me compassion, empathy, you know, that medical school curriculum, find it very hard to teach, but it just was part of the environment that I trained in. It was, you know, amazing. It's a big responsibility, especially at the International AIDS Society level. It's a very big organization. It's a huge honor to lead the IAS. It has about 16,000 members all around the world. You know, and those who came before me as presidents are really the who's who of HIV science leadership. So it was a real honor to be elected. But now, of course, we have another pandemic, and so we really are at a time when how do we continue to put HIV/AIDS at the forefront of the response and truly try and achieve the global goal of ending AIDS by 2030. So I feel this huge burden as president of the IAS to keep sending that message, to keep reminding countries and funders and, you know, other scientists and community groups to, you know, we've got this last mile to achieve. Yeah. Well, going back, we've got traditional tools like condoms, we've got clean needles and syringes, we've got, you know, methadone for people who use drugs, we've got pre-exposure prophylaxis, you know, that's been shown to prevent people from acquiring HIV. We've got this amazing treatment that can bring down the level of HIV to what is known as undetectable, so people who are living with HIV do not pass the virus to others, whether it's to their babies or to their sexual partners. So we have all this already. The only thing that we don't have is an effective vaccine. But we've got lots of things that we can, you know, really put an end to AIDS. But it goes back to political will, financing, stigma, discrimination, criminal laws, policy that's stopping us, really. HIV is one of those diseases that's not just medical, right? And that, in a way, was what attracted me to it. That's a whole other what we call social determinants of health. All these things makes it a really rather complex disease. So yes, we have all the biomedical tools, we have all the pills to prevent HIV, we have all the pills to treat HIV, but surrounding that are all these issues, these barriers, the stigma, discrimination, laws. But I don't think we're not getting anywhere, especially when it comes to drug laws. For me, every single little win is a win. I'm conscious that something like changing the country's drug laws is not going to happen overnight. So even the very fact that we now have the government talking about, shifting the response to looking at drug use as more of a health and social issue rather than purely from a criminal justice system, to me that's already a big win. Yes, there's still a lot to do. There's 4 holy grail in HIV, I guess. One is cure, one is vaccine, number 3 is stigma and discrimination, how to overcome stigma and discrimination, and number 4 is, once you found all those 3, how to implement it to scale. I mean, part of the problem in medicine, not just in HIV, is we make all these great discoveries, but we're not very good at implementing and let alone scaling them up, with the exception of the COVID vaccine, because there was this urgency, right? The whole world was going to collapse, and so as soon as we found the COVID vaccine, we scaled that up pretty well, apart from the inequities that exist in rolling it out in Africa and many other countries. But so I think there's still plenty of research that needs to be done in many areas, but in those 4, specifically in those 4 fields. And this is where we keep the research in HIV alive. People do their research, they present, they network, they see their research being expanded, they see their research being implemented. So I think the IS plays a very big role in continuing that excitement around research. So that's at the global level. And finally, of course, locally, 2 things there. Of course, Chiria, and we're working very, very closely with my colleagues at Yale. Also a partnership that's been going for more than 15 years with Professor Rick Ortiz. We have currently, I think, 5 or 6 NIH grants. A big one for the prison project, and several on using mHealth or digital technology to reach out to vulnerable populations like MSM and transgenders. So there's 4 or 5 ongoing projects at the moment with Yale. And of course, the one that Rick and I are most proud of is what we call the MISS program, the Malaysian Implementation Science Training Program. It's a 5-year grant from Fogarty Institute of the NIH. And we've structured the grant in such a way that we select 2 PhD students and 2 faculty members to be trained in implementation research. So they participate in lectures that are given by the Yale faculty online, and they go to New Haven for 5 months to get in-depth training in implementation research. And we have an annual boot camp here in KL. So the reason why I'm particularly proud of that is, of course, when you talk about what do I leave behind after this, I think that will be it, and we're hoping to turn it into a master's in implementation science. The other aspect of it is we've also got a grant from WHO to also do implementation science. So we're marrying that together. It's a consortium with UN University as well as Ministry of Health. That's the WHO program. So we're aligning all that together. I'm very keen to, apart from mentoring, is to institutionalize some of these things, because like what you said, it's got to be inbuilt. Otherwise, once I leave, it will go, right? So I don't want that to happen. this is the other insane project I did. After changing the undergraduate curriculum, I thought I will tackle the postgraduate curriculum. Of course, that's not so simple because it's not just it's 10 other universities and Ministry of Health and 23 specialties. 5 years later, we now have 11 curriculum that's ready, and I'm extremely proud of this because it was, and a lot of people worked hard on it. But now I think we're ready to implement them, and hopefully once again it will be a legacy we can all be proud of, because the aim of this curriculum is really to train specialists in a more modern way, in a competency-based framework that's being practiced by advanced nations. But the one that I regret, I guess, is another crazy big idea. Is the Health. That didn't go so well from my point of view. I mean, towards the end of my deanship, I think we were working with PwC and we had the plans for the implementation phase, but unfortunately it's not going in the way that I would have liked it to go. So I have taken a step back from it, and but I take failures, I learn from it, and move on. Well, you know what? Someone texted me today and thanked me for Prof Wu has just been awarded the FIGO award for being a world leader in obstetrics and gynecology, and she said she wanted to thank me as part of her ascent, if you like, because I've mentored her in a way and lifted her. And to me, as there are two things that when people ask me what do I think are my biggest achievements, and number one would be my children. Number 1, 2, and 3 would be my children. They've both graduated, and one started working, and hopefully, inshallah, the younger one will start working. And apart from that, they're also very sensible, well-rounded people, So that, without a doubt, is my biggest achievement. And second would be, I think I have encouraged and mentored and quite a number of people that I'm very proud of, either the infectious disease team, Prof Iskandar, Sharifah, Sashila, Dr. Wong, even Dr. Noliza, who's now in private. So that's one group of people, who have made name for themselves now. Dr. Rina, who's doing fantastic translational work. And then on the Curia side, Dr. Ika, Dr. Rumana, and Asan, and so many people that I hope, I can be the next generation of people who continue the work.